Okay, well, my name's Christy Kane-Apple, and I'm the marketing director here at BIS Technology Group. And I just wanted to go ahead and tell everyone thank you so much for joining us on the call today and for our webinar on how to prepare for the 2015 HIPAA audits and avoid data breaches. So I'm going to go ahead and introduce our speakers. We have Phillip Long. He's the author of Everything You Must Know About Choosing an IT Company, but Your IT Guy Will Never Tell You, and he's the CEO of Business Information Solutions. We also have Art Gross, President and CEO of HIPAA Secure Now. Phillip, I will turn it over to you now.
All right, great, Christy. Well, thank you. And again, we do appreciate you guys joining us today. And we would like to even have some feedback as to the best time for you guys if we do things like this again for the medical practice. If we could get some times that would be maybe more effective for you guys, because I know it's tough for you guys. Probably at 2 o'clock in the afternoon. That was kind of an afterthought for us, but. Today we're really going to talk about some things that are very relative to everyone in the medical business. And I know I was at the MGMA in Birmingham, and almost every speaker had some element of the HIPAA and risk assessment, breach security within their talking. And it's just prevalent because it really is that important. As a guy that works in technology a lot, there's just so much data that flows, and the data is really very valuable. And so kind of as a company, what we want to do is we want to make technology easier for folks. And one of the ways that we felt that we could do that is by connecting with this company that Art owns called HIPAA Secure Now. And he has really I think a really value-packed product and process, as well as his staff that do the actual risk assessments and auditing and consultation to help you guys out. And when I saw it, I immediately knew, I'm like, wow, I need to have that in my portfolio for my practice administrators, because you guys are busy, and you don't want to be so busy that you don't protect yourself. And Art really brings something to the table here that will that's easy, and it will absolutely keep you from getting fined. And it's also very cost effective, which rarely do you get all those things into one package. So I'm going to turn it over to Art, and he's going to kind of discuss some of the risks that are out there, as well as I think he's going to kind of let us peek into how his product works. So Art, take it away, buddy.
All right. Thank you, Philip. I really appreciate the opportunity to present today, and thank you, Christy, for the introduction. I've just go through the agenda real quick. We'll take a look at the current healthcare IT landscape. What's going on in terms of all that information that Philip was talking about. Take a look at the 2015 audits. Everyone's concerned about being audited and any HIPAA-related fines. Then we'll go into the HIPAA security rule. What's it mean to be HIPAA compliant? And then, there's the HIPAA Omnibus rule that makes changes to the other previous rules that we have. So keeping track of all this is very difficult, but I'll try to, sort through that. Then we'll talk about major breaches and what we see that are some of the causes of breaches. And then the cost of breaches, how expensive it could be to an organization, the cost of a breach, and what goes into that. And then maybe most importantly is, how do you protect all this information so you don't have any audits and you don't have any fines? Then I'll briefly talk about the HIPAA Secure Now services and how we can help you. And I probably won't do as good a job as Philip did in talking about how good our service is, but I'll let you know exactly what we do. So I appreciate that introduction. And then at the end, I should have said, at the end we'll open it up for questions and answers, and anything that you need more information on, I'd be more than happy to provide. All right, so taking a look at the healthcare IT landscape, we're seeing a big push towards electronic health records, big push away from paper-based charts to electronic health records. And that's all being driven by the Meaningful Use Incentive Program that the government is incentivizing practices, healthcare practices, hospitals to implement electronic health records. They've given out close to $30 billion worth of money to implement electronic health records. And over the last 4 years, we've seen a big push towards electronic health records. As a negative, we've also seen over 100 million patient records breached in the last 4 years. And 80 million of that is through the Anthem insurance, so that the California insurer. So you're starting to see a lot more breaches and a lot bigger breaches, because breaches are a lot easier when they're electronic. It takes, take 80 million records. I don't even know where you would put 80 million records, but you could put 80 million records on a USB drive. So, easy to lose that type of information. And what we see now is that the government and Health and Human Services and the Office of Civil Rights have basically vowed to increase HIPAA enforcement. They need to protect all of this information that is now electronic, all of this money that they gave out to incentivize medical practices and healthcare organizations. They want to protect all this information. So you're going to see a lot more HIPAA enforcement coming. All right, so let's talk about the 2015 audits. And as Paul Revere is screaming here, the audits are coming, and they've been coming for a while. They were supposed to start sometime in 2014. They were delayed to the end of 2014. They're supposed to start the beginning of 2015, and already into May now. So we're not going to hit the beginning of 2015. But Health and Human Services have vowed to implement a permanent audit program to, very similar to what the IRS does in terms of auditing, returns, to make sure that there's compliance, either compliance with tax codes, and in this case, compliance with HIPAA regulations. So what's going to happen is Health and Human Services are going to select between 500 and 800 covered entities, medical practices, hospitals, and they're going to contact. You're going to get a letter from Health and Human Services saying, you have been selected as a pre-audit, and out of those pre-audits, they're going to pick 350 covered entities to audit. So it's not going to be 100,000 organizations, but it's going to be 350 covered entities are going to be selected to be audited. And then out of that, 50 of their business associates, IT companies, law firms, billing companies, transcription companies, they're going to be audited as a phase 2. And what's going to happen is you receive this letter that you're going to have 2 weeks, and you're going to need to upload a series of information: the size, the location, what are some of your services. All the details haven't been really, fleshed out yet, but once you upload that information, you will then be told whether you were picked to be audited. And the audits are going to be a combination of desk audits and on-site audits. And desk audits are where you just submit information. The auditors take a look at it, and they let you know whether you've passed the audit or you didn't. On-site audits, they actually send auditors to an organization. They're on site for up to a week looking for information. There were previous audits, and these were pilot programs. About 115 organizations were audited and basically just collecting information. But unlike the previous audits, if you fail this audit, there's going to be fines handed out. In fact, Health and Human Services has been very clear. They said, we are going to fund our budget by the fines that we collect from audits and from HIPAA violations. So, they have a very self-interest to hand out fines, so that increases their budget. I wish I could run a business like that, but that's what they've decided, how they're going to fund this, and basically use those funds to ensure that there isn't even more compliance. Okay, so as I said, there's going to be 350 practices or covered entities that are going to be selected. Out of those, 150 are going to be audited for compliance with the security rule. And I'll go into some of the details in the next slide or two on the security risk assessment, ensuring that you've done a security risk assessment, that you have business associate agreements with your business associates, that you've trained your employees. Another 100 will be on the breach notification rule. So if you were to have a breach, are you prepared in terms of having the policies, the content to notify individuals, and then how timely will you be able to react to a breach? And then 100 organizations will be audited on the privacy rule. Make sure that you have up-to-date notice of privacy practices, that you give patients access to their health records. And then as a phase two, 50 business associates of the covered entities will be selected to go through the audit to make sure that they are doing their security risk assessment and that they're ready, if they had a breach, to report to any of the covered entities that they work for. Okay, so people are worried about the random audit program, and there's lots of talk about, I don't want to be selected, I want to make sure I'm compliant. But there's lots of other ways to be, in OCR's scope, so to speak, and have them come knocking on your door. One is the audit program that I just discussed, but two is a breach investigation. So if you were to have a breach, if you sent an email to the wrong patient, if you lost a laptop with patient information on the laptop, that could cause a breach that potentially could have OCR investigate the breach. In addition, you could have a business associate that had a breach, your IT company, your transcription company, your lawyer, your billing company. If they have a breach, OCR could come not only looking at the business associate, but we've actually worked with clients where their business associates had breaches. OCR investigated the covered entity as well. So not only, you may not have had anything to do with that breach, but the business associate caused a breach, that it opens an investigation of your HIPAA compliance. You can also be investigated by a complaint, and that could be a dissatisfied patient thinks that their privacy was breached, or disgruntled employee, someone who's working for you, and then maybe they got laid off or something like that, and they open up and they file a complaint. OCR may come investigate that. So you don't only focus on the 350 organizations. The way that you have to worry about is not only the random audit program, but breaches by your organization, breaches by business associates, complaints by patients, employees, could even be a competitor of yours that could file a complaint and potentially could open up an investigation. So, the chances of OCR coming knocking on your door is much larger than just the random audit program. And in addition, I mentioned the meaningful use program. What we're seeing is there are meaningful use audits are occurring. In fact, 1 in 5 eligible providers of the meaningful use program is being audited. So 20%. So the chance of being audited is much greater than 350 organizations. And what we're seeing is that you can either be audited for meaningful use, either pre or post payment, meaning the government has given you money and you're audited. That's a post payment. So they go back and take a look at 2012, make sure you really deserved the money that was given to you, or you attest for meaningful use this year. And before they give you the money, they will do an audit to make sure that you have satisfied all the requirements. And the line highlighted in red is important. A failure to perform a security risk assessment is a frequent reason for failing meaningful use audits. They are really looking for security risk assessments. Most of the requirements for meaningful use are handled inside of the EHR. The security risk assessment is one of the items that's outside of the EHR and needs to be done. And a lot of organizations are checking the box. Yes, I did a risk assessment, and they haven't done a risk assessment. Not only do you have to do a risk assessment, but you have to have a work plan to show that you're going to implement security to address any of the findings in a risk assessment. So if you have a risk assessment that just has yes or no, that may not pass a meaningful use audit because, one, it's not telling you your risk level, and two, you may not have a work plan to address any of your deficiencies that you have. Meaningful use payments could average about $10,000 depending on what year you're in the program. So if you fail an audit and you have 3 providers, you may have to write a check for $30,000. And if you fail for meaningful use audit in 1 year, they could go back and look at, you failed for 2013, they can go back and look at 2012. And you have to write the check within 30 days, otherwise they start charging you interest. And not only is CMS, the Centers of Medicare Services, doing audits, but now OIG, the Office of Inspector General, part of Health and Human Services, are going to do more meaningful use audits. And instead of looking at 1 year, they're going to look at 3 years. And if you fail, you may have to provide all of the meaningful use incentive funds that you've received back to the government. So very important to understand that audits could happen for meaningful use, random audits, HIPAA violations and investigations. So it's really important to understand that the risk of being audited increases every day. Okay, so what is requirements? Going back to the HIPAA audits and making sure that you're compliant, what's required? And a lot of the times we talk about HIPAA as though it's like one law, but it's really broken up into multiple rules, right? There's the privacy rule and the security rule. The privacy rule is all about how patient information, how you can use that information, who you can disclose it to, what a patient could restrict access to. And a lot of times we think of the privacy rule with, concerning paper, all right, paper charts and faxes. The security rule is all about the administrative, technical, and physical safeguards around electronic protected health information, patient information, all right? So when you look at electronic health records, digital x-rays, so the security rule protects all of that information that is stored or sent someplace or accessed, right? So the privacy rule is about access to patient information and restricting. Security rule is all about protecting all of this electronic data that is being created. So what exactly is do you need to do to be compliant with the HIPAA security rule? The first thing is to perform a security risk assessment. And a lot of times people don't understand what exactly is a risk assessment. From a high level, a risk assessment looks at where information is, how you're protecting it, and what are some of the risks to happening. So you have data on electronic health record, and in EMR, EHR, a fire or flood destroys that server. What's the chance of that happening? And if it does happen, what's the risk? Well, if you weren't doing backup, that data could be gone, and then you'll never get those patient records back. So a risk assessment looks at all of those pieces and comes up with a risk, and obviously makes recommendations on how to lower the risk. Just to walk through the steps so it's a little more clear, you want to identify and document all the electronic protected health repositories. Where is patient information stored? It could be in electronic health records, it could be in email, it could be on USB drives, it could be on digital records, digital x-rays, it could be in ultrasounds, MRIs, glaucoma machines. So the diagnostic equipment. So you really want to identify where all that information is. You can't protect it if you don't know where it is. You want to identify and document potential threats and vulnerabilities to each of the repositories. So, a fire, flood, a lost laptop is a threat. A terminated employee, is disgruntled and comes back into the network and destroys information. And then you want to assess current security measures. How are you currently protecting the data? Do you have encryption on laptops? Do you do backup or disaster recovery? And then from there, for each of those threats that I mentioned, what's the likeliness of a threat occurring? People lose smartphones. You think about likeliness in low likelihood, medium, or high. Losing a phone may be a low or a medium likeliness. And then what's the impact? What happens if that does happen? If you lose a laptop that has 1,000 patient records, that could be a very large breach. And that's how you determine risk. And then once you determine risk, and think of risk as a low risk, a medium risk, or a high risk, then you want to determine additional security measures needed to lower the risk. How do we make a high risk a low risk? And then you want to document all of your findings. It's very important. HIPAA is really very focused on documentation. If you get audited and they ask to see a policy or your risk assessment and you don't have it written or documented, auditors are going to say you're not doing it. Even though you may be doing it, without documentation, you could fail an audit. Right? You also need to develop policies and procedures that address the administrative, physical, and technical safeguards. So, termination procedures, you need to have those documented. Physical, you want to make sure that you have servers in a locked closet, making sure that is documented, that's implemented and documented, and also technical safeguards on encryption, making sure that all laptops are encrypted, or that you're using complex passwords and changing passwords. In addition, you want to make sure that you provide employees with security training, that they understand the HIPAA rules and requirements, and that they know what to do to protect patient information and the risks to patient information. You also have to have an incident response plan. So if there was a breach, that you know what procedure you're going to use to respond to that breach, to stop the breach, to determine what happened, then also to report to patients and Health and Human Services what happened with the breach. You also need to maintain business associate agreements. So any business associates, IT companies, transcription, billing companies, you have to have agreements with those vendors. So if you were to get audited for the security rule, these are the items that the OCR is going to be looking for. Okay, so that's the HIPAA security rule. In 2013, the HIPAA Omnibus rule was released. So we first had the HIPAA privacy rule, then we had the HIPAA security rule, and then we had the HIPAA Omnibus rule, which changed both the HIPAA privacy rule and the HIPAA security rule. So that's the government for you, but that's exactly what happened with HIPAA, and the HIPAA Omnibus rule made some pretty significant changes. One, the notice of privacy practices, that document that you give to patients when you first, when they first become a patient, has to be updated. There's new text. So if you don't have the revised notice of privacy practices that you give to patients, you need to update those privacy documents. Business associate agreements. The first thing is business associate agreements need to be revised. So if you haven't revised a business associate agreement with one of your business associates in the last 2 years, you need to go back and take a look at those documents and update them. There's new text and new requirements that have to be included in the documents. But the big change that the Omnibus rule made is it made business associates directly regulated by HIPAA. Okay, before a business associate only needed to sign that agreement. Now a business associate needs to not only sign the agreement, but they need to do the same thing that a covered entity needs to do. They need to do a risk assessment, have policies, train their employees, have an incident response plan, and they need to have business associate agreements with their downstream contractors. So now HIPAA went from about 1 million organizations to over 3 million organizations that are regulated under HIPAA. And now the other big change is cloud providers are business associates. Okay, so even if the data is encrypted, so if you are storing data on Dropbox or you're using Microsoft Office 365 or Google Gmail, they are now all business associates of yours, and you need business associate agreements. The interesting part about this is if you're still using AOL, Yahoo, MSN, and you're using that to send patient information, PHI, those providers will not sign a business associate agreement. They will not, comply with HIPAA regulations. So really using those services are not HIPAA compliant. If you're using Dropbox, Dropbox will not sign a business associate agreement. So any information that's patient related in Dropbox is not HIPAA compliant. Microsoft with their Office 365 will sign a business associate agreement, and Google will sign a business associate agreement, but only with their paid Google app. So if you're using a free Gmail account, they will not sign a business associate agreement with you. Other changes are the new data breach rule. So I like to say you're now guilty until proven innocent. So if you lost a laptop and you can't return, you don't get the laptop back, and you can't prove the data was not accessed, you have to assume that any data on there was accessed, and you have to notify those patients. So we're going to see a lot more breaches because of this new rule. It's very, very difficult. You have to almost forensically prove that the data was not accessed in any type of breach. So if you have a hacker that gets into your network, you have to prove what the hacker did and did not get to. Otherwise, you have to assume it got to all your patients. You have to notify all your patients. So this is a significant change. And then the last big change here is fines are now up to $1.5 million. So if you had a breach and OCR investigates that breach and finds that you were not protecting this information, you could receive a fine up to $1.5 million. Now, a lot of times someone hears that $1.5 million, those are only for hospitals. Just recently, a small pharmacy that had, I believe, 6 employees received a $125,000 fine. So, you could get fined up to 1.5 million, but you can also be fined 50,000, 100,000, 250,000, which could have a significant impact, and could put an organization out of business even. Okay, so talking about breaches, so this is now we'll get into those were the fines. If you were to have a breach, breaches are really expensive, and these numbers that I'm going to talk about have nothing to do with fines. Fines are on top of this. All right, so there was a study that did a cost of a data breach and said that an estimate for a healthcare related breach is it's $233 per record. So if you lost, if you had a breach with one record, it's 233 dollars. If you have 1,000 patients, say it's on a laptop and in a spreadsheet or some sort of file, that could cost an organization $233,000. If you had 10,000 records, maybe that's in your EHR, hacker gets in and accesses that, you have $2.3 million worth of expenses. And just so you know, most liability policies do not cover HIPAA related breaches or HIPAA related fines. Okay, so one of the things that they sell separate policies that are cyber and HIPAA insurance policies. So a lot of times when you look at these numbers, your insurance may not cover the cost of these breaches. So what makes up the $233 per record? All right, and again, remember the fines that I mentioned, the $1.5 million worth of fines are not in this number. So this is the actual cost of a breach. Then you can get fined on top of it. And the big thing here is if you have a breach, there's a damage to your reputation. Okay, so that you may make the press. You may, people may write about it, and patients may decide to leave your practice. I don't trust you with my information. I'm going to go find another provider. Or you may lose future patients or, in sense of non-healthcare organizations, customers. So, a patient may decide, you know what, I read about this breach. I want to find another provider. I don't want to use this. So the big piece of that $233 is damage to reputation. It's really lost revenue, either, losing patients or losing future patients that may, go towards your revenue stream. Just a quick story, Phoenix Cardiac Surgery. They are a small cardiac surgery center in Arizona. They had a breach. They had a very small breach. They were sharing information on Google Calendar, and one patient could see another patient's information. Didn't affect that many patients, but OCR came in, did an investigation, found that they had no policies and procedures. They didn't do a risk assessment. They didn't train their employees. You basically were not complying with HIPAA and fined the organization $100,000. If you don't have insurance, that's a pretty big hit. But if you did a Google search on Phoenix Cardiac Surgery, what you'll see is the first result is their website. The next 8 results or 9 results on that page is all about this HIPAA related fine. And if you go the next 8 pages, it's all about this HIPAA related fine. So if you're a patient in Arizona looking for a cardiac surgeon and you come across this, this Google search, you may not know anything about this HIPAA related, fine, but what is this? This doesn't look right. Maybe I want to find another cardiac surgeon in Arizona. So, very much damage to their reputation. And, as you know, once it's in Google, this could be up for years. It's very hard to get rid of this and to get past it. In addition, Health and Human Services is very nice to if you have a breach and it affects more than 500 patients, you have to report it to Health and Human Services, and they're nice enough to put it on their website for the world to see. And it's been nicknamed the Wall of Shame, right? So not only someone does a Google search and finds that you had this breach in Google, but now they come across this Health and Human Services and they find your practice on this Wall of Shame. Again, you may lose future patients that don't want anything to do with your organization because they don't trust you and they don't trust the fact that you will protect that information. So those are the indirect costs. There's also direct costs of a breach. All right. So detection and escalation costs, figuring out what happened, working with, forensics companies and crisis management. And believe me, we work with clients who have had breaches, and it is very stressful, very nerve-wracking because you don't know what it's going to do to, your job or to the practice and to your patients. There's also notification costs. So there's IT activities to pull all of this information together to figure out what the requirements are. You want to get your lawyers involved, postage, all these things that you have to do to notify individuals. And then there's the post-data breach costs, help desk activities, inbound communications, calls from patients, as well as providing identity protection services, credit monitoring. So all in all, a breach, you can see why the $233 makes up that breach, and you can see, depending on how big the fine is, the big the breach is, how expensive that could be. Excuse me. Okay, so let's take a look at some of the categories of breaches, like what could happen. What we see is the leading cause of breaches are lost laptops and portable media, and I'll go into some of what happens and how you can protect that. Inappropriate access to patient information makes up about 30% of breaches. Email, sending unencrypted email, 10% of the breaches, and hacking up until the Anthem was only 10% of all breaches. Now is much larger. But historically, hacking has been small, but it's becoming much bigger and bigger. And lost backup tapes make up all breaches. So if you're still using backup tapes, there's still a risk of a breach because of that. Let's take a look at each one of these categories. So lost portable media, lost mobile devices, laptops, smartphones, USB drives, CDs. And what we hear a lot is, oh, we don't have any patient information on our laptops. We don't have it on our smartphones. And then we run some scans and we actually find 600 Social Security numbers on a laptop. And we find all of this PHI in smartphones. So I truly believe organizations don't think they have PHI on their laptops and smartphones, but you can have scanned explanation of benefits. You can have Excel spreadsheets that are out of the billing system. You could have download reports out of the EHR. In fact, we see some web-based EHRs cache PHI in temp files. So you don't even know it's there, but we found hundreds or thousands of Social Security, credit card information, date of birth, all within these temp files. So these laptops and portable media have a lot of information, and we're seeing a lot of thefts and employees losing this, causing breaches. One of the things that you want to do is look at encryption. Encryption is a safe harbor under the HIPAA security rule. We like to call it a get out of jail free card, meaning any device or data that's encrypted and it's lost or stolen would not result in a reportable breach. You would have to document it, but you wouldn't have to notify any patients. There wouldn't be any reporting to Health and Human Services. Basically, there wouldn't be any damage to your reputation. Encryption is inexpensive, easy to implement, and the more that you can encrypt, the lower the risk of having one of the leading causes of breaches. So we highly recommend encryption. Inappropriate access to patient information and inappropriate access. A lot of times you think of external organizations. Chinese hackers coming in and stealing information. But what we see a lot of is employees with inappropriate access. You see snooping. All right. Kim Kardashian, when she had her baby out in California, 6 nurses were fired because they were looking in the EHR and trying to find out information, and they had nothing to do with her care. And they were fired because they were caught. Stealing of patient information. What we're seeing in Florida, gang members are getting their girlfriends hired at medical practices. Girlfriends are going into electronic health records, downloading the information to USB drives or emailing them to themselves, giving it back to the gang members who are using it to file false tax returns. They're making $40,000 to $50,000 a night selling, filing false tax returns, and it's rampant throughout Florida, spreading to other states. So all of this inappropriate access, and then you could have disgruntled employees that are going in and modifying or deleting information. So you need to protect against this unauthorized access. And how do you do that? Well, one of the requirements of the HIPAA security rule is to have auditing enabled. That's why everyone under HIPAA has to have a unique user ID and password. And all actions that they take, when they access a patient's record, they update a chart, they download a report, needs to be audited. Most EHRs have that auditing. But in addition, you need to do an audit review. You need to periodically check to see, what your employees are doing. Is there an employee downloading 1,000 patient records a day while everyone else is accessing 20? Why is that employee doing that? If you're not looking inside these audit logs, you may have no idea that this is occurring. And the other thing is you want to make sure your employees know that auditing is in place, it's being reviewed, anything that they do will be, be identified. It may deter some improper access that may occur. Okay, hacking. Hacking is now becoming a very large concern. The Anthem hacked 80 million patient records. Outside of healthcare, you've heard of the Home Depot and Target. A lot of this information is very, very valuable. Healthcare information is extremely valuable. In fact, a credit card on the black market is worth 99 cents. A healthcare record on the black market is worth $50 a record. So, this information can always cancel a credit card. You can't cancel your healthcare. You can't change your social security number. So we're seeing that thieves are eyeing up healthcare organizations and, stealing that information. The CHS breach before the Anthem was 4.5 million records. We're also seeing CryptoLocker and programs that are using encryption and encrypting data and holding it ransom. So if you want that data back, you have to pay for it. So, hackers are becoming much more of a menace, a nuisance, and a real risk to business. How do you protect against hackers? Passwords. The easiest way is to use strong passwords, to change passwords, to use complex passwords, account lockout. The more you use strong passwords, the more your employees will scream at you and be mad because they have all these passwords. But it really is important to use, strong passwords. Make sure that systems have antivirus on servers, desktops, laptops, even smartphones now. Make sure that it's all your systems are patched. Your IT company should be patching your systems. And then vulnerability scans, making sure that there are no known vulnerabilities that a hacker could exploit. What we see is anytime there's a breach, OCR wants proof that you've done vulnerability scans, that you've patched those vulnerability scans. So if you haven't, they're going to say you left patient information exposed and potentially fine you even more than you would have if you would have done vulnerability scans. Okay, and then finally, lost backup tapes. Backups are great, right? Because if something happens to your data, you can always restore it. But you think about these tapes or external USB drives, that it holds all of your data. So it'll back up your EMR, it'll back up your file server, it'll back up maybe your PACS systems, your digital X-rays, and all of that is sitting on that tape. And if that tape is lost or stolen, and it's not encrypted, all of those patients could be breached. And really what you need to do is start to look at offsite backup, automated backups that get rid of tapes, that secure the data, that encrypt the data in transit and store it on servers. You want to make sure you have a business associate agreement with any company that's doing that. But you also need a disaster recovery procedure, all right? And that's a requirement under HIPAA security rule. And having a backup tape alone is not a DR plan, all right? Saying, well, we'll just get another server, because that server, it could take 2 weeks to come in, reload the data, and then you could be without access to patient information for 2 weeks, 10 days, 2 weeks. So very important to have a disaster recovery plan that is implemented. It's documented. You know how to declare a disaster. You know how to, employees know how to, implement the disaster recovery plan, what to do, and also that it's tested. You want to make sure that in a disaster, a hurricane, a flood, some sort of, think about what happened up in Boston when the city was locked down, any sort of that type of disaster that you can't get to information, how are you going to still provide access to patient care? Because once you get rid of the paper charts, you still need to be able to access all this information. Okay, so that is, things that can happen to patient information. As Christy and Philip said, we working with BIS have a service called HIPAA Secure Now, and we try to make this as easy and painless as possible to not only comply with meaningful use, but also HIPAA compliance. We provide the security risk assessment. It takes about an hour to work with us, an hour to 2 hours to work with us. We provide a security risk assessment work plan. So we'll perform the risk assessment, we'll document it, we'll also provide you with a work plan to lower the risks that we find. We implement HIPAA security and privacy policies and procedures, and we have videos that explain each one of these policies to your employees. We have HIPAA security training and privacy training for all employees and new employees very important to train your employees. We teach them about phishing scams. We teach them about how to protect patient information, what they should and shouldn't do. They take a quiz. They need to get an 80 or better. They can take it as many times as they need, but they get a certificate. You also get a training report that shows all your employees have been trained. We provide a module to upload business associate agreements and track business associates. We provide updated notice of privacy practices that I mentioned before. We have a security incident response module and a breach notification module to help you if you do have a breach. And our services, as Philip said, are very, very affordable. We're offering a 10% discount to anyone that attended this webinar. Christy will be sending out information to all the attendees with that information on how to work with BIS to look at the HIPAA Secure Now service and also to receive that 10% discount. And that is the presentation. Hopefully that gave you some insight into the HIPAA audits, some of the requirements, some of the costs of a breach, and then how to protect the breach against breach. And I'd be more than happy, I'm sure Philip would as well, to answer any questions that you may have and give you any more guidance if you need some.
Yeah, that was really a great job, Art. That's a lot of information. I was not aware. One of the most startling things was that, did I hear that correctly, that 1 in 5 are going to be audited?
That it's going on. We have a client a week that calls us up and says, I got this letter, from there's an accounting firm. It's a Filioli, part of CMS that's being audited. So it is happening. There's a much greater chance of being audited for meaningful use than it is for just HIPAA. So if you are part of that meaningful use program, it's happening. And now OIG, those are even worse because the meaningful use audit looks at 1 year. OIG looks at 3 years. And if you fail any one of those components, they want their money back. So you potentially, if you've gotten 4 years of payments, which is $44,000 per provider, you have 10 providers, you're writing the government a check for $500,000. So it's very important that you make sure you do those risk assessments, that you keep all that documentation to prove that when you were tested for meaningful use that you deserve those payments.